ready to start?
Yep.
So I'll do a quick intro. This is Dr. Harry Adelson. He's a naturopathic medical doctor. He has performed over 10,000 stem cell procedures, as in has injected stem cells into over 2,000 intervertebral discs, placing him solidly among the most experienced in the world with the use of stem cells for the treatment of musculoskeletal conditions. So he is on the scientific advisory board of the Muse cell innovations and is the inventor of the full body stem cell makeover, and is the founder of Docere Clinics located in beautiful Park City, where he lives with his not two wives, sorry, one wife, and two children. Two lovely daughters who sent me photos. They are firecrackers. I believe they just won some medals in martial arts.
That's right.
So I expect nothing less from Harry's offspring. Yes. And he's also the co-founder of Stark.Health, and that is in Austin, Texas. So a very busy man. Now, how I met Harry. So when in 2015, I was in my third year of medical school. And there was an ND who came in and spoke about all of the possible kind of things that an ND can do once they graduate. And she said, and there is this doctor in Utah, and all he does is PRP. At the time she said PRP, but then I found out it was more stem cells. And I came from an like a sports medicine background. I was a trainer. I was also competing in martial arts for 10 years, and so athletics and performance has always been an interest of mine going into naturopathic medicine. So when I heard about Harry, I was like, oh, this is interesting, and I just was like, okay, I'll just email him, and I did, and he was really open and really gracious about sharing what he does and how he was able to kind of move forward the scope of practice in the state of Utah so that he could do what he could do. Because I don't know if you guys are aware, in every state for naturopathic medical doctors, the scope is very different. So for example, what he can do in Utah, I cannot do in California. I cannot put patients under, I can't cut their skin, I can't put sutures on them, I can definitely not do any sort of bone marrow aspiration or liposuction. But in Utah, Arizona, other states, NMDs can. So I asked if I could visit and shadow him, and he was, like I said, very gracious, allowed me to come. That time I didn't get to see a procedure, but a few years later, as I started working for Stark and just kept following what Perry was doing, I was like, I think Todd can benefit from that, our guinea pig. So now a little bit into that, he was also instrumental in guiding at least the different kind of organizations that was teaching the injection therapies. So that was really cool. So that exposed me on training even as like a fourth-year medical student and also afterwards as well. So thank you so much. You know, it's always a pleasure to have someone like you. And he mentioned this earlier. He was like, I don't know why people don't ask me to come talk, and I was like, no, you're a titan in our community. You know, maybe they just are a little scared of you, maybe intimidated, I don't know. But anyway, so again, we talk about you a lot, especially since Todd has had your procedure. So, so the first question that I'd like to have for you, sir, okay, so I'd love for you to describe what regenerative injection therapy is, and specifically your specialty.
Sure. So, hi guys. Thank you so much for having me. This is just terrific. So, I'll just sort of give you a little bit of background how it all started. So, when I went to naturopathic school because I fell in love with the philosophy, and I was horrified by the big food industry. You know, I saw a direct line between the obesity crisis and the diabetes and metabolic disease and General Mills. And so I sort of fell in love with the naturopathic philosophy and ended up going. And while I was in naturopathic school, I was completely fanatical about rock climbing. And that was part of the reason I went to naturopathic school, so I'd have something to do when I wasn't rock climbing. And I was training for a trip to France, which is the birthplace of modern sport climbing. And I was doing this hard cross-through move in the gym, and I felt this revolting pop in my shoulder. And I said, oh, that's not good. And I went and saw a surgeon, and he said, well, you've torn the cartilage in your shoulder. I can put a scope in there. I can cut that piece of cartilage away. It will help in the short term. It's probably going to give you problems later in life. Alternately, I can put a steroid injection in there. It'll get you through your trip in France. You'll probably do fine, but it'll demineralize the bone and give you problems later in life. And I thought, those are terrible options. I don't like either of those options. So this was back in the 90s when, in order to do research, you actually had to talk to people. And I found out about Rick Marinelli, who became my mentor, and this was a naturopathic doctor who did prolotherapy. And prolotherapy, of course, is the predecessor to all of the regenerative injection therapies. It's the injection of natural substances to effectively trick your body into thinking that it's endured a new injury, thereby launching the body's natural healing cascade. It's usually a sugar water, so it's nutritive and slightly irritating. So you get all the benefits of a healing response without actually having been injured. So I did that. I fell in love with it. I did it for years, and that was my practice revolved around that. I was fortunate enough to have done one of the few hospital-based residencies available to naturopaths. And I volunteered in a homeless shelter in Bridgeport, Connecticut. And here was this community of men who all had chronic pain, and they couldn't take any drugs because they were in they were in a halfway house basically. So I did prolotherapy on those guys for years, and that's how I developed my skill initially. And I thought that was it. I thought that was what it was going to be. And the MDs who did it back then were squarely in the alternative realm. So they sort of welcomed the naturopaths because we were kind of weird and they were kind of weird, and they loved what we were doing. And then platelet-rich plasma came along. And that was a little more medical. It was a little sexier. You had to use these expensive kits. The orthopedic surgeons were kind of interested in it. And so we started doing PRP because it was sort of the natural evolution of it. And it worked better. Anything prolotherapy could do, platelet-rich plasma could do better. Platelets, your blood consists of sort of the cellular components, platelets, and then the serum. And so the platelets are what are responsible for clotting after injury. But they also signal your endogenous stem cells. The stem cells in all of your tissues, when there's platelets in the area, they signal for those stem cells to activate. So that worked better than prolotherapy. And then in 2009, I had a patient who I'd helped for a period of time, but I couldn't quite get her all the way there. And she came into my office. She put a big stack of papers down on my desk. She's an engineer, and she said, Harry, I want you to put bone marrow stem cells into my knee. And I said, Laura, I don't do that. I said, I know a guy in St. Louis who does it. You could go to him. And she said, I don't want to go to your friend. I want you to do it. And I said, Laura, I'm a naturopathic doctor. Do you know how much flack I'll get if I start doing bone marrow aspirations? And she said, Harry, I'm a materials engineer for NASA, and I'm a woman. So if you want to complain to me about people telling you that you're out of your league, I'm afraid you're talking to the wrong person. And I had nothing to say. So I called this orthopedic surgeon. I said, would you be willing to teach me how to do a bone marrow aspiration? He said, absolutely. When do you want to come? And that was 2010. And I was about the 10th person in the US to do bone marrow stem cells for the treatment of chronic pain. And I did it, and it worked so well. And I knew that was the future of regenerative medicine. And soon after that, I learned how to aspirate fat, how to do a fat aspiration and isolate the stem cells from fat. And for years, for 10 years, that's what I did. And that's what we did with Todd. And what you have to understand is back in that time, in 2010, 2011, 2012, very few people had heard of stem cells. Like, it was not cool in the US. It was just not a thing. So I was going to South America to do it, not for legal purposes. It was because it was hot in Brazil and people wanted it done. So I would go down there to practice and really learn it. And the only people in the US who had heard of it were cowboys, were horse people, were these wranglers and ranchers. And it was because the first people in the United States to really do stem cell medicine were the veterinarians. And so these guys had these very expensive workhorses that would get too old and arthritic to work, and they would take them to this veterinarian, and the guy would do bone marrow stem cells on their hooves, and they'd get 2 or 3 more years of work out of them. And these guys were very pragmatic, and so they would say, well, can you do that to my neck and my back and my hips and my shoulders? And the guy would say, well, no, I can't because I'm a veterinarian, but there's a guy in Park City now, go to him. So I'd get these busted up old cowboys, and they'd come to me and they would want me to do these huge treatments on them. And so that's how it all started, was I, these guys would come, I'd do their whole back, and I'd do both hips, and I'd do both knees. Well, then Dave Asprey became a patient, and then Ben Greenfield became a patient, and Mark Hyman became a patient. And these were people interested in longevity, and that's sort of the start of this full body stem cell makeovers. People, like, if you're gonna do it, if you're gonna come, we're gonna spend the time, we're gonna spend the money, let's just do everything while we got you there. So that's sort of, I kind of launched this whole long thing, but that's how it all started.
Yeah, and by the way, like, when I was there for Todd's injection, and he came in, and Todd was already under, and on his, I think it was to start with the stomach first, and he walks in, he looks, he's like, where's the fat? And I was like, try to get fat before the procedure. But he went in and he was doing, of course, just the lipo aspiration. And I had to say, I didn't admit this to you, but I stood there and I watched it. I was like, oh, I think I'm getting a little lightheaded right now. Where's the smelling salts, But
sit on the floor.
Luckily, I didn't go down. I remember you saying that once. You're like, I usually don't let people come in and shadow because I don't need to be concerned about someone passing out while they're watching the procedure. I was like, okay, I won't do that. But I was like, ooh, that was kind of close. But it was definitely a fascinating procedure to see because, again, like as a naturopathic doctor doing this, this is like kind of like the peak, the top of like crossing into that conventional realm, which is really fascinating. So where do you see, like, now you've gotten to the stem cells, so what do you see as being next? I mean, you're the scientific advisor on the advisory board for Dezelwyn stems from the Muse cells. Can you go into what those Muse cells are?
Sure. Well, let me just talk about umbilical cord first. So for years I did it with bone marrow and fat, and it worked very well, and I was very, very happy with it. The downside about using that stuff is it's hard to go through. I mean, it requires a liposuction. It requires a bone marrow aspiration. So the entire procedure takes like 3 hours because it's 45 minutes to do the tissue harvest and then 45 minutes to isolate the tissue because you have to put the fat through an enzymatic digestion. It's a whole process. And then we do the injections. Well, I had an experience where Ben Greenfield sent me one of his movie stars. And he came to me, he was, an action star who does his own stunts. And he was getting ready to do a film where he was going to do, but his back pain was so bad, he was sort of moving around like this. So we did the procedure. We did his lumbar disc, his intervertebral disc. We put stem cells into intervertebral discs, and he had a great outcome. But he tweaked his back doing his movie. So he called me up and he said, Harry, we were doing great, but I tweaked my back doing wrestling, jumping off a rope and doing this stuff. He said, will you do it with umbilical cord stem cells? This was 2021. And I said, I've heard of it, and I knew it was being done internationally. I wasn't really sure if we could do it in the US. And so I said, look, I won't promise you that I'll do it, but I'll promise you that I'll look into it. So I did a deep dive, and I realized we can do it here in the US. The issue is, what we can do here in the US is we have this 361 pathway. The 361 pathway is the human cellular tissue pathway. So when you go to get a kidney transplant, when you go to get an eyeball, when you go to a tissue bank, tissue banks is where they keep that stuff. Well, you can keep umbilical cords in a tissue bank, and you can keep umbilical cord stem cells in a tissue bank. What we can't do here in the US is we can't culture expand the stem cells. We can't grow them out in a laboratory. The other thing that we cannot do in the United States is speak about it as if it is an FDA-approved procedure. So what that means is you have people like Tony Robbins, who owns the stem cell clinic in Panama. You have people like Joe, no, the other Joe, Joe Rogan, thank you, who owns the stem cell clinic in Colombia, shouting from the rooftops, you got to go abroad to do this stuff, because they're conflicted. I mean, that's just sort of, it's unfortunate, but that's the case. We can do it here in the US. We just have to be very careful what we say about it, because anything that can be construed as treating or curing disease, well, then you're running afoul of the FDA. So similar to Laura and doing bone marrow on her, I went ahead and did an umbilical cord stem cell treatment with this guy, who, by the way, offered to do an Instagram post for $1 million. And I said, no, we'll just keep the NDA. It's cool. We're good. Everything about it, I love. So really, since 2022, I really haven't looked back, and it's just a much better way to go. So we can use these umbilical cord stem cells here in the U.S. So that's sort of like the last since 2022. Dezawa Muse cells. Have you guys heard of the Muse cells? So when you talk about a stem cell, is a cell that has two abilities. When it divides, it can either turn into a new version of itself or differentiate into a target tissue cell. That's number one. Second, it has the ability to do something called the paracrine effect, where it recognizes that it's in the presence of damaged tissue and then communicates with that tissue to help it to heal. It fights invading microbes, controls inflammation, and then signals for damaged tissue to heal. Now within that definition, there's many different types of stem cells. There is one particular type that this woman, Marie Dezawa, discovered in 2010, which is she calls it the Muse cell, which stands for multilineage differentiating stress enduring cell, MUSE. These are the Navy SEALs of stem cells. For one, they're 1/4 the size of a regular stem cell. So when you do it IV, when you do normal stem cells IV, they normally get trapped in the lungs, and then they dump all the contents. They dump all the growth factors. And it's sort of like a delivery truck just dumping sort of the cargo into the river, and then you're dependent on the river to take the growth factors where you hope it goes. The Dezawa Muse cells, because they're so small, they pass through the lungs, and then they have very sensitive receptors for distress signals from damaged cells. So it's almost like a motorcycle with GPS. It can go directly to the damaged cell, and then it's able to survive this stress enduring. They're able to survive some of the harshest environments. So whereas when we normally use the umbilical cord stem cells, they only last really just a few days in your body. These Muse cells last for years. Now, they don't take up residence in your body, so there's no concern about, I'm not going to get blue eyes, for instance. Like, you don't take on the person's genetic characteristics, but they execute this paracrine effect, this healing effect, and then they will actually eat. They phagocytize. They eat the damaged cells and then turn into that type of tissue. And the last sort of amazing thing about these Dezawa Muse cells is, whereas most mesenchymal stem cells will turn into like fat and cartilage and bone, the Muse cells actually can turn into just about any type. They are truly pluripotent, like an embryonic stem cell, but embryonic stem cells are very dangerous because it can turn into sort of cancer and that sort of thing. Whereas these they're not tumorogenic.
Yeah,
so that's sort of,
differentiation.
Right.
That's
so
always a concern for some patients. Like, oh, stem cells are going to cause cancer, these tumors that could grow teeth. They're definitely not that.
Correct. That's the embryonic stem cells, which of course there's the whole ethical issue of using an embryo as well. Right. So this bypasses all of that. And this is very exciting because these Muse cells have been around for years, but they are just now entering the United States. And largely it's because Utah has a law that Utah has basically come up with a law within the state legislature that says, we know this stuff is not FDA approved and we're okay with it. So while using them, I still could potentially get in trouble with the feds because I only talk about it at events like this and I'm not talking about it on the internet or something like that. I'm probably not going to get in their crosshairs.
Gotcha. Yeah. Wow. So are you using that in the same manner as the umbilical stem cells, where you're taking those Muse cells and injecting it directly?
I probably will continue to use the regular umbilical cord stem cells in the site-specific injection, and then we'll use the Muse cells as an IV for, sort of, yes,
Gotcha.
yes.
Oh, interesting. Okay, gotcha. So let's go into the procedure that you do. Now, I do the injection therapies. Oops, sorry, probably hit something there. But I will not touch spine. Like, I have not received enough training. I have not received enough mentorship, and I don't feel comfortable. There's no guided. Like, you do fluoroscopy guided injections to do that sort of thing. So just kind of walk through that, like what you essentially do, especially what you did with.
Well, I'll show this video really quickly. So this is what a full body stem cell makeover looks like. This is about a 1 hour procedure that you're going to see in 1 minute time lapse. So we do everything under IV sedation. Oops. We do everything under IV sedation. So we put people completely to sleep. This is, let's see. So we start the person face down. First, I do epidural stem cells. That's putting stem cells in the epidural space, not steroids. Then I do the facet joints, every level, both sides, from the base of the skull down to the tailbone. My partner, Amy Killen, there was doing the scalp to thicken the hair follicles, finish with a caudal epidural. This is Ben Greenfield, by the way. We flipped him over, both shoulders, both hips, both knees, both great toe. Amy Killen comes in and does the skin of the face. I come back, do the elbows, wrists, and thumbs. To finish it up, Amy does the sexual optimization. So in the men, she does the penis to improve microcirculation, because erectile dysfunction is a circulatory disease. In women, she does the vaginal tissue to improve elasticity and microcirculation. And then it's a little too fast, but we finish with the sphenopalatine ganglion, which is putting it right into the 5th cranial nerve.
Can you talk about that real quick? Like, what does that do?
So the 5th cranial nerve, I'll just let this play for a second. So the 5th cranial nerve is, so we have the brain and then the spinal cord, but then we have these 12 cranial nerves. The eyeballs are obvious, they're nerves that just come directly out of the brain. They don't come through the spinal cord. The 5th cranial nerve, if you've ever heard of the trigeminal nerve, if you've ever heard of like trigeminal neuralgia, it's a big nerve that comes off the side of your brain. But it's direct access to your brain. So you're able to do, there's an injection that's used it's usually for like atypical facial pain or trigeminal neuralgia. But if you put stem cells and exosomes there, it's basically getting the biologic product this far away from your brain without putting a needle into the spinal cavity, or into the cranial cavity. It's an injection that I've done for years for this sort of like atypical facial pain or trigeminal neuralgia. But since I've started using it with stem cells, it's been amazing for any sort of neurocognitive conditions.
Gotcha. All right. So those are our now. What does the recovery look like? Because I know that for him, you had very specific instructions about what he can or cannot do a month afterwards.
When we did it with Todd, we were doing that bone marrow and fat, so it was really rough to go through because it was a liposuction. I mean, it was a liposuction and a big bone marrow aspiration. Nowadays, like, instead of it being 3 hours, it's 1 hour, and people wake up and they're fine. I mean, it's quite amazing because it looks horrible. It looks like the Spanish Inquisition, but people wake up amazingly and they feel better than they did when they go to sleep because the stem cells have such strong anti-inflammatory properties that people feel great when they wake up. It's really quite wild.
When Todd was done with this procedure, like, we had to wheel him out, and he was just not moving very well. He was definitely, I think he was more in pain from the actual liposuction.
Yeah.
Is that true?
The skinnier,
Be all over.
the skinnier people are, the worse it was with the lipoaspiration. So it's really nice to have put that behind me. I don't miss it at all.
Gotcha. So those two, you rarely do it and never do it nowadays?
Occasionally, I get people who are so paranoid about the COVID vaccine. The laboratories that I use only accept the umbilical cords from non-COVID vaccinated mothers. But there's people who are just so paranoid about it that that's, yeah, anyway.
Gotcha.
Yeah.
So afterwards, with the recovery, like do you have any instructions, like when it comes to
Most important thing is no dentist for 2 months. You can't go to the dentist for 2 weeks before and 2 weeks and for 2 months after.
Dentist.
Yeah, because anytime, like if anybody's had a hip replacement, like anytime you have a major surgery, you can't go to the dentist because when you go to the dentist, they poke around in there and you always get bacteria in your blood and usually it's fine. But if I'm doing epidural injections, those bacteria go, oh, I think I'm going to go here, and then you seed infections. So yeah, in 25 years, I've only had one infection, and it was a guy who went to the dentist the next week, even though we told him not to. So so that's the most important thing. Beyond that, it's 1 week of taking it very easy, second week of reintroducing normal daily activity, and then 2 months of no new injuries. Don't get on the roof. Please don't get on your roof. I get all these Park City guys. They're like, well, I was on my roof. I'm like, what's wrong with you? I got a guy. His name is Silvario. He would love to get on your roof. He charges $50 an hour. Let me introduce you to him. But so no new injuries, please, for 2 months. But that's pretty much it. I mean, people can start exercising after 2 weeks.
Gotcha. And we have the head of chiropractics here, Dr. Justin Chang. But have you seen cases where if they did something much more structured when it comes to rehab, either ART or FRC or EMT, is that helpful to maximize?
Yeah, you bet. I mean, I think core strengthening needs to be integral in everybody's lives because that's just so critical. But we have a physical therapist that we refer to, and you bet, it's critical.
Gotcha.
Mm-hmm. And the one thing you were asking about spinal interventions. Yeah, we do a lot of we do cervical discs too, but we do a lot of intervertebral discs as well. And that's some of the most rewarding work that I've done is because when you get a dehydrated disc, nothing destroys your quality of life faster than that. And being able to put stem cells in a dehydrated disc it's like magic. It's amazing. It's my favorite thing to do.
Gotcha. Well, those are the questions that I have. Do you guys let's bring it out to the
Sure,
audience.
yeah, sure.
So,
sorry, I don't know if I kind of zoned out or not, but can you just explain what the difference is between embryonic, umbilical, and Muse cells, and where
Sure.
do they come from?
Sure. Yeah, so embryonic is in vitro fertilization. So you take an egg and a sperm and then you get an embryo. And that is arguably a human life. And that's the one that is so controversial. Umbilical cord stem cells, a woman goes to the hospital to have a baby. There's the baby, and then there's the birth tissue. And the birth tissue is the placenta, the umbilical cord, and the amniotic membrane. Those, when a woman gives birth in a hospital, she's given 3 choices what to do with those tissues. She has them medically disposed of, she can keep them, or she can donate them. If she donates them, she gives the hospital permission to take possession of it. In the fine print, she's also giving the hospital access to her health records in a redacted form. So then laboratories will contract with the hospital to then take possession of the birth tissues and her redacted health records. And women who undergo only cesarean section, it has to be cesarean section, because if they pass through the vagina, it gets contaminated with bacteria, which is great for the baby's microbiome, but it's, contaminates the tissue for use. But a cesarean section is sterile. So cesarean section births, non-COVID vaccinated mothers, the laboratory takes possession of the birth tissues, takes it straight to the laboratory, does all the testing for communicable disease, and then processes it that day. It's frozen that day, and then minus 85 degrees frozen, like not this kind of freezer, like medically frozen. Then it's not thawed again until I get it, until the doctor gets it in their hands. If anybody ever says they don't, oh, the cells don't survive the freeze-thaw method, ask them, well, how does in vitro fertilization work? Because 100% of those embryos are frozen, and you get a baby out of that deal. So, like, how does that work? Like, that cell pretty much survived. So, those are like, when we're talking about umbilical cord stem cells, that's that. Muse cells. So when you grow out the stem cells that you get from an umbilical cord, there's a lot of different types. About 2% of the stem cells that you get in there are these Muse cells, which are these multi-lineage stress-enduring cells, which are these super highly potent stem cells. Those are the ones that, that's sort of this specialty type cell. That was, and then what was the third thing you asked? I hate it all. Right.
The user part of the
Yes,
okay,
yes,
100%.
yes.
Perfect. Thank
Yeah,
you.
sure. Oh, sure.
Sorry, you get into family questions.
Yeah, of course.
I'll personalize it. So were I to come see you, and I have a litany of orthopedic things, as Dr. Justin's treating tomorrow, do I walk in and I say, hey doctor, so listen, I got a shoulder thing, I got an elbow thing, I got a knee. Do you require like MRI? Do you require?
So we do a consult. So like if you're interested in getting treated, you reach out to us, we connect. I have you fill out some basic paperwork, which doesn't seem like much, but I get a lot of information from it. Then we do a 30-minute consult where I hear the whole story. I hear everything. And this is on the phone, like, you don't need to come into Park City. Then we make a plan. If you want to do site-specific, we talk about that. If you want to do this, we do this. When I do this with people who have, shoulders, hips, and low back, but they want to just hit everything, the shoulders, hips, and low back get higher doses of product. We're still going to go ahead and do your ankles and your elbows, even though you don't have problems with it now.
Right.
Hopefully you'll never have problems with it, so we may as well hit it while we're at it, but we'll just put a much higher quantity of product in the areas of primary concern.
Okay, do I need, we fill out paperwork and everything as part of that consult, but I'm personalizing. For me, I don't know, is it my labrum, my rotator cuff?
I figure that out for you. No, yeah, I'll figure that out for you.
So I don't need imaging that you go.
It's helpful to have imaging. I usually don't need it, but because I base, what's interesting about diagnostic imaging is it's almost useless. It's crazy. But if you look at the scientific literature, if you look at people who've never had low back pain, no history, people over the age of 45 who've never had low back pain, 60% of them have abnormalities on MRI. 15% have abnormalities so significant that if they had corresponding symptoms, they would be candidates for immediate emergency surgery. But these are people with no low back pain. So how bad the MR looks doesn't even predict whether you have pain to begin with. So I base my analysis mostly on the history, on what you tell me. I ask you some very specific questions. Then if you have imaging, then once I hear that, then I'll look at it and then we'll see if it corresponds or not. And and I'm interested to look at it, especially with those dehydrated discs, because that is one finding that is very obvious. And if a person has pain right smack in the middle and putting the baby in the crib is like the worst thing they can do. And we see, your L2, L3, and your L4, L5 are black on T2 weighting. Yeah, that's probably your problem. So we've got our system pretty dialed. Yeah,
Thank you very much.
yeah.
And to be fair, my father gives me permission. I tried to refer my father to Dr. Harry, actually, a few years back. And he looked at my father's history, his notes, questions, and stuff like that, and he said, no, I actually don't think you're a candidate. So, because my father had more neurological kind of damage, and he said, this is someone who would not do well with the treatment that I would give. So he's a straight shooter. He's not just going to inject you just to make money. So,
yeah. It's bad for business. Seriously, it's.
It's very, very true. So.
What are some of the neurocognitive issues that you've treated?
Just straight up, old timers disease. That's I mostly focus on low back pain, neck pain, garden variety, musculoskeletal conditions. But I've gotten to do that sphenopalatine ganglion injection on everybody, and I've just found people tell me, I'm not treating like profound dementia or anything like that. Nor am I doing really Parkinson's just because that's just not my area. But consistently people tell me they sleep better, they have vivid dreams, they feel better, they feel more sharp, that sort of thing. So.
Do you still use PRP at all?
No.
What about the longevity of the PRP treatment versus the stem cells?
PRP is such a mixed bag. I mean, I can't tell you how many times I've had people go to the emergency room because they thought they had an infection, and I'm just like, it just hurts. Like you can do the same person once and they do fine, and then you do that same person a month later and they have this like massive flare up. It's maybe they ate a Domino's pizza. Like, I don't know what it is, but it's just like PRP is such a Russian roulette as far as like flare-ups and painful outcomes and that sort of stuff. As soon as I switched, even bone marrow, which is very similar, I mean, it's a blood product, that never happens. So when I started doing BMAC, bone marrow aspirate concentrate, I never looked back. I was so happy to stop doing PRP. With umbilical cord, there's never any flare-ups. Like, I'd never get flare-ups. It's such a relief. So yeah, PRP works, but you have to do a lot of treatments, and it's really painful to go through. And I just, anything PRP can do, stem cells can do better.
So between the various stem cell treatments, which one has the greatest longevity or the best results?
Doing the bone marrow and fat works very well. It's rough to go through. I'm interested to start doing the Muse cells. I haven't, we're waiting for the first shipment ever, so I don't know yet. But the umbilical cord, if you look across my practice at everybody, all ages, everything that I do, about 70% of the people that I treat are happy. And by happy, I don't mean, 100% pain relief, but like enough that they're glad that they did at the 1 year mark, they're glad that they did it, and they don't feel like they need another one. Then we wait. Basing it, I've only been doing the umbilical cord since 2022, but going back to when I was doing BMAC and SVF, average is between 2 and 8 years, and average is like 4 or 5 years. So, usually 5 years, we do great. Like, I don't hear from them again, and 5 years later, it starts to come back, and they want to touch up. 20% of the people do okay. They get some improvement. Maybe we talk about doing a second treatment at the 1 year mark. About 10% of the people I treated, I just don't help. It's just a dud. And usually we were saying, frequently these are the people who aren't completely forthcoming with me about how much alcohol they drink, because booze puts you in a state of chronic inflammation. Like, it just kills stem cells. Yeah.
I believe one of the instructions you had for Todd was that he couldn't drink any alcohol for a month after.
It's bad. 2 months is great. Like, if people can do 2 months, that's really best.
It's easy for him like that. But
Yeah, and if you can't take 2 months off of alcohol, you got a problem. I'm sorry. If you can't,
I think with that information,
Yeah.
even as opposed to dentistry, people need to know.
Yeah,
Drinking is going to dissolve your life.
Yeah.
You guys are going to create a recession. The tobacco industry dies.
Yeah.
cool. Any other questions?
How does this work on knees? Like, if you have sporting incidents, most of my friends were mountain bikers because we don't do so well laterally anymore. Meniscus damage and whatever. How does it work on knees?
So I want to talk a little bit about interstitial fractional laser. So in addition to the stem cells, one of the things that I've started doing in the last year is this interstitial fractional laser. So you probably heard of fractional laser from the spa. Like, ladies go and you put this laser on the face and it puts these little channels through the skin without burning the skin. And then in those channels, you grow new collagen fibers, and it improves the elasticity and hydration of the skin. So this laser that I've gotten out of Russia, you place a needle. I usually use it for intervertebral disc, but we can use it on meniscus. That's a big indication also. You place the needle, then you thread this fiber optic filament through the needle, and then it sends this interstitial fractional laser, which coagulates the tissue and normalizes it. So when you get damage to intervertebral disc, when you get damage to a meniscus, it's normally this sort of like gelatinous substance, but when it's injured, you get indwelling like blood vessels, and then when you get blood vessels, then you get nerves in there. It changes the structure of the tissue. So that's something that I've been doing this last year, which I've been very excited about. But so a torn meniscus, your option is go in and surgically just cut more of it away, or between the stem cells and this fractional laser, we're gonna actually try to like restore it to its original state. And that's a big part of what we do. I've been doing knee injection for 25 years, first with Prolo, then PRP, and with stem cells. And if it's me, I put stem cells in there.
How about arthritic fingers?
Yeah, for sure. It's any musculoskeletal structure is and that's I treat a lot of rock climbers, so I treat a lot of arthritic fingers. I treat a lot of musicians, a lot of artists. But yeah, we just drop it in all your interphalangeal joints, and you bet. And that's a good one to be asleep for. Yeah, that hurts. Like, there's no way to make that not hurt. Yeah, yeah.
Hands and feet.
Yeah, for sure. Yeah, that's a good one to sleep through.
And that's the I was managing the care of another patient who was had a very low threshold for pain. For his shoulder, and I injected him once with PRP, and like he couldn't handle it. And I was like, I think I'm gonna have to send him over to Harry so they can put him under. But yeah, it's that benefit of putting that person under so they don't experience
we were saying, I used to, like when I first started sedating people, I would give people the option. I'd say, you can do it awake or you can do it asleep, whichever you want. And I think there were some people who were like afraid that I would think they were a wuss or they didn't want to spend the money. And then I would talk to them, I'd do their year follow-up, and they'd say, oh, it didn't work. I was like, oh, really? Are you playing tennis? Yeah, actually I'm playing tennis 3-4 times a week now. Oh, really? Because here it says you couldn't play tennis at all. Yeah, but I started doing yoga, and I'm pretty sure that's what did it. And I'm like, and I realized they were just mad at me because I hurt them. Like, these are the people who decided to not get. So then I think I started telling you, like, I had this woman. I used to get these Young Living essential oils peoples in. I don't know if you believe it's like multi-level marketing, and these are people who are like really into alternative health and. Oh, I'm in great health. I haven't been to the doctor in 30 years. And, their blood pressure's through the roof. And so I had this woman, and she's on the table, and we were doing a bone marrow aspiration. So, and I just had like a little pulse oximeter on her finger, and it zeroes out. And I look, and she's not breathing, and her ears turn purple. And I'm like, are you kidding me? So we yank the bone needle out, we flip her over, we're about to put the AED on her, and then she does this. And I went, and she goes, what happened? And I said, what happened is you just gave me one hell of a scare. And she said, did I die on the table? And I said, why are you saying that to me? And she said, oh, because anytime I have any sort of procedure, I die on the table. And I'm like, it didn't occur to you to mention that to me? So yeah, after that, I was like, that's it. Everybody's going to sleep. That way, if anything goes sideways, it's his problem, and I just hand him stuff. So yeah, so it's much better to have the anesthesiologist there.
For sure.
I probably shouldn't tell you guys that story.
All right. Do we have any other questions from the audience?
Yeah, I've seen, oh, go ahead, please. Yeah, have you tried this yourself?
Oh, of course. Oh, yeah. That's how I got into it. It was anything I do, I'm having it done to me first.
You
so
have a trusted doctor who does it for you, right?
Sure. But I've got, I have a network of folks that I like and trust and I work with, and I treat them and they treat me, and for sure, yeah. I mean, I've had all sorts of, torn my hamstring, all sorts of stuff. But my shoulder, like,
Your shoulder, yeah.
to this day, I just injected it last week.
Really. Okay, so
Do my own.
not only, yeah, so you're a client as well.
Oh, for sure.
Fantastic.
Yeah.
Hair
Yeah.
club.
Yeah, that's right.
Oh, so I do have one question. So Dr. Amy Killen does all the aesthetic
Yes.
stuff like that. So obviously, like the penis injection, the vaginal, the O shot as they call it, and also hair injections and whatnot. So, what's the efficacy that you guys see in that?
For hair, if there's no hair follicle, it doesn't bring the hair follicle back. It's for hair that's thinning. So and for me, it cut my gray about in half. Like that was the big thing that it did for me. Is it
And that
really?
was with the umbilical stem cells, or
When I had it done, it was with my bone marrow. When I had it done, it was back when I did my bone. I had bone. I didn't have that. I just did bone marrow, and I supplemented with some exosomes, but it significantly reduced the gray in my hair. The skin, I mean, it's, it's completely different. Like Botox is for lines of facial expression. Filler is to increase volume. Stem cells just is different. I mean, it's just its own thing. It increases elasticity and hydration of your skin, which is just its own thing. And so it doesn't, it doesn't look, oh wow, what did you? You just look really well rested. And then with the sexual optimization, erectile dysfunction is a circulatory condition, and one of the things that we know that stem cells do is grow new healthy blood vessels. That's why there's so much research on wound care, because wound care is when you can't grow enough blood to grow new skin, and then you perform an intervention. In this case, it's putting stem cells, and then you're able to grow blood vessels, and then you're able to grow skin. With women, it's the same idea as the skin. It's increasing the elasticity and hydration of the vaginal tissue, which is, you can approach that with hormones to a point, but then there's actually like sort of the brick and mortar aspect of the skin that you address with the injections.
Gotcha.
If there's a desiccated disc and you inject into it and you repair that, can you actually make someone a little bit taller?
Well, I would have figured that out by now. Yeah, no, I don't think so. Yeah, probably not.
The actual question is, so you understand we have a very robust ecosystem, and we can do things within the ecosystem to prep a patient, like my friend over here potentially, to be in the optimal state when he goes in, and then help him recover and heal when he comes out. What are some of the things, and I'm assuming most of your patients don't have like a Stark ecosystem that they step in and out of. What, in an ideal set of circumstances, what would be perfect for someone to go into a procedure, and what can be done on the backside, like with Justin's team?
All the stuff you guys are already doing, like it's all fantastic. I mean, it's anti-inflammatory lifestyle, strengthening, especially core strengthening, and mental emotional stability. I mean, you guys are hitting all of that stuff. So.
Okay, so better quality sleep.
You bet.
HRT.
You bet. Yeah, you bet. Yeah, you're already doing all of that. So yeah.
Justin, any questions about that?
Are you utilizing peptides?
I'm not personally. Amy Killen does a fair amount. We have an oral peptide solution that she designed that we give everybody. But it's just, I'm so focused on what I do.
Gotcha.
Oh, that was BPC 157, right? That's what you gave me?
I think it's like 5 different molecules. And that's one, and BP 1157 is one of them.
But before the treatment to boost.
We give it after. We just give it after. It's like a month supply. We just tell people to take it. That and nitric oxide. I'm real bullish on nitric oxide. Yeah.
Echoing what Todd just said, prior to doing whatever procedure, is there like a obviously I don't drink, but anything, do we have to be off of TRT? Do you have to?
No.
Period of cleaning,
No.
Anything?
No.
Obviously no dentist afterwards, but it's.
Yeah, no dentist and lay off the booze, but that's really it. And then just all the, no. I mean, if someone's on like heavy anticoagulant, then yeah, we need you to come off the anticoagulant.
It's just another medication. It's not one of those things. Stop taking thyroid.
No.
Stop doing that kind of.
Not at all. No, not at all. Not at
And
all.
how long do I have to be out from training? When can I start
Just-
lifting again?
Really just 1 week of heavy training, and then second week you just reintroduce slowly, and then by the third week you're back to normal. But you don't want to do like box jumps or something like that, especially if we're doing your.
I would love to. If you can get my knees in shape.
Yeah. Well, you just wait a couple months. Like that's like we just like you don't want to do it immediately after. Yeah. Yeah.
Thank you.
Yeah.
Very cool. Well, thank you so
Oh,
much.
thank
for
you guys.
coming and
This.
speaking
Oh,
to our
you
group.
bet. Of course.
And I also want to thank
Thanks, Doc.
Paul for actually allowing us to do it in this location, this beautiful location. But thank you so much.
And
for
if you
coming.
guys have questions, I'm just Harry at Doceri Clinics. Please just email me with questions. These guys can get you in touch, but please use me as a resource if you have questions. I'm happy to help you guys out any way I can.
Thank you so much.
Thank you so much. Thank you. Thank you. Thank you.